neurology. I specifically focus on Parkinson's disease, and a specific part of my practice is devoted to the caregivers of those with neurodegenerative disease, because I do feel strongly as a personal caregiver and in my professional career, that's a place that we see a lot of health issues kind of fall through the cracks. And also, patients spend such a small amount of time sitting in my office and much more of their time sitting with the people that they love. So educating and providing tools to those caring for somebody with a neurodegenerative disease is a really important part of prevention in healthcare, I feel. I am originally from Michigan, the Upper Peninsula of Michigan, a very small town in 2000. And I joined the military after 9/11. I felt a very strong call to serve. Met my husband there, and we traveled around the country together with his different duty stations and decided on a second career of medicine after many years and many jobs. So I kind of call this my second life. We have a lovely 11-month at home, Waylon, named after Waylon Jennings, and 2 golden retriever therapy dogs. So that's my life. I live out in the country in Rathdrum and love northern Idaho. I've been here for a year now. I've been with Choline Healing Arts officially, I would say, since July on a regular schedule, and just kind of getting settled in. So I'm happy to be part of this community outreach and get to know people in the area and help where I can. So that's a little bit about me, and before I get started, I will just say this is super interactive. I do really well with interactive. Dr. Hunter was saying, it's an open forum, so while the focus is exactly what the topic was in the magazine and on social media and whatnot, I'm open to fielding any questions in general that you have to the best of my ability. And then obviously we have Dr. Hunter here as well who can help out if there's anything else. So go ahead and get started. Do you have any, just general questions, curiosities, interests that anybody wants to start off with?
I'm interested in just supplement ways to help my focus and memory with age.
Okay.
And what I could take to help.
Great. I'm going to write some of these down, and we'll see if there's a organic flow to it. Do you guys have any questions? Any thoughts that you want me to cover today?
I'm just interested in brain health.
Okay.
I'm a patient of Alzheimer's.
Great. Okay.
But my mom has dementia.
Okay.
And so, I just feel like any information I can get is great.
Yeah, absolutely.
My mother had Alzheimer's ran in the family, so
Okay.
of course I'm interested in that prevention.
Yeah. You raised your hand, or you raised your banana, brother?
No. Do MRIs always show brain abnormalities?
Okay. And somebody also brought up the polyvagal theory, right? Being interested in learning about that. I know that was in my topic list. Is that a good place to start? Okay. Well, we'll talk about supplementation. So as far as my philosophy and practice, I rarely find that a medical condition is due to a deficiency of supplements or pharmaceuticals, right? I truly believe that given the proper environment, our body has the innate ability to heal. I also believe that we don't live on a planet that offers the proper environment for the body to be able to heal. So as far as supplementation goes, it really varies as much as the individual does. There are some specific ones that are indicated for brain health, for anti-aging, to reduce oxidative stress. Kind of the golden rule that I tend to go by is whatever's good for your heart typically is good for your brain. It is an immensely huge vascular system in our brain that often gets overlooked. And a lot of the theories of the etiology or the onset of Alzheimer's disease has been brought back to cardiovascular insufficiency. The other part of supplementation that I'll kind of hit on is inflammation. So inflammation and stress and oxidative stress all have been implemented in many neurodegenerative diseases. Hi, welcome.
Hi.
We just got started, so. So a lot of supplementation that I would focus on would be to decrease overall stress load in the body, of course, also addressing how that supplementation gets to the very end of your capillaries, which we'll talk about with the polyvagal theory, and exactly what aspect of brain health we're talking about. So there are some great like I said, minerals and nutrients that are necessary for our brain to function, neurotransmitters, cofactors, all these great things. But truly, where I would start with anybody who says, hey, what do you got for supplements? I would say, what are you experiencing, and how can we facilitate that through your lifestyle, diet, exercise, and make sure that your body's able to facilitate that. And then kind of going into supplementation distinctly on what complaints or concerns that somebody is having. And we can dive into those a little more specifically if you like, but I think in all actuality, with my philosophy, again, I tend not to go with, hey, this is because of a deficiency in X, Y, and Z all the time, but more so, how are we utilizing it, and where can we get that from in our body or our environment. Did you have any questions on specific supplements that you've heard of, or?
Not anything specifically, I guess.
Okay.
I was interested in how to lower inflammation too.
Okay.
I know that's tied in with brain health.
Brain health, absolutely. So I'll kind of go into supplementation with some great ones that I really love. They're in the broad category of nootropic. So how we call this nootropic, TROPIC. And one of my favorites is rosemary. I love rosemary. Bacopa is a really phenomenal botanical that can help with memory and recall and different things like that as far as the brain health goes.
I've taken that one.
Great. Ginkgo is a phenomenal one that has probably been the most researched and published supplement out there, but sometimes, that doesn't always equate to the best effect. So I do love ginkgo, but it's not at the top of my list. I love turmeric. It's a great anti-inflammatory, lowers the inflammation, helps decrease, that overall inflammation, and it has an affinity for the brain, as does boswellia. So those are my top two brain anti-inflammatories. And then when you're talking about the nootropics, again, I love rosemary, bacopa, ginkgo. Blueberry, anything again that helps the cardiovascular system, because that's going to help get the supplementation up to the brain, are really some of my favorites. Magnesium is a great one.
How about choline?
Choline is phenomenal. Yep, I do use choline quite a bit, so that's going to be more supportive of the structure of your neurons in your brain. Fish oil, I would have to say probably my ultimate favorite supplement of all time is fish oil. I'm a high doser. And just again, kind of backtracking a little bit on supplementation, it's an interesting conundrum, I guess, that we're in, where the FDA doesn't regulate the quality of supplementation. So I have this conversation with every patient that comes in. I know we chat about it a lot at the clinic, is that because the regulation of the supplements it's not there for the FDA, quality supplements that are actually quality assured by a physician or by somebody who understands what should be in there and what is actually in there, and knowing the fillers is really important when you're supplementing. And then therapeutic dosing. This is super essential. More often than not, I see somebody come in and unload 30 supplements on my desk and say, I'm taking all these things, I'm just taking one a day because I don't want to take too many pills. And what I'm seeing is that it's either not enough to have the effect that we want it to have, or it's interacting with something else and it's not effective. It's interacting with your food, so it's not effective, or we're taking it at a time and we end up just peeing it out if our body can't use it. So really understanding that supplementation is a science and an art, and our body uses those nutrients that we give in a very intentional way. So in supplementation, in all, I would say, speak with somebody who understands how to prescribe that, so you're getting the most benefit from it. But yeah, the choline, I do love phosphatidylcholine, phosphatidylserine, L-carnitine, lion's mane is a great mushroom that's used a lot with dementia, Alzheimer's disease, mild cognitive impairment. So there's a vast array of them. Again, it just depends on how people present and what they're looking for. And then of course the dosing is going to vary with all those as well.
Is turmeric and curcumin the same thing?
No. So curcumin is a constituent of turmeric. So turmeric is the whole spice. Curcumin is the active constituent that's within that. So when you find a supplement that says turmeric or curcumin on it, you're going to want to make sure that the curcuminoids, the part that's in the label, is at a certain percentage or potency to have the actual effectiveness that you're looking for.
So do you need both to complement each other?
Not necessarily. So I would think of like turmeric and curcumin, like the broad spectrum. There's like the broad term for it. It's the root, if you say, like the actual whole root of the plant. And then when you take the active constituent, the curcuminoid, that's the part that's having the effect in the body. So curcuma longa is the Latin word for turmeric. And then you're going to break that down. So each plant, each botanical that we take has different, what we call constituents in it, different parts that do different things in the body and have different effects, just like a pharmacologic would. So that's, I don't know if that answered your question or not.
No, it didn't.
Okay.
I mean, do you take both of them then, or?
No, I'm sorry, they're essentially the same thing. So if you're taking turmeric, which is equivalent to curcumin, what I'm saying is that making sure that what's on the label of what you're taking has enough potency to do the job that you're wanting to take. So if you are taking turmeric, then yes, that is the same as curcumin, but it's not the same as the active constituent that is in it. If that,
I'm taking curcumin, but not turmeric.
then you're fine, that's fine.
Okay.
But the curcuminoid is the part that we're looking for in the curcumin for the effects that we're seeking.
Okay.
Does that make sense?
Well, I assume the curcuminoid is in the curcumin.
It is. Yep. But what happens again in manufacturing, and I hit on this so hard with manufacturing and supplementation because there are so many third-party distributors out there that actually will take out the active part of the botanical and fill it with fillers. And so when we read the labels and see, oh, it's 90% curcuminoids or it's 60%, making sure that that label potency matches what's actually in the supplement is just really important. I feel very passionate about making sure whatever you're putting in your body is as labeled, and because we don't have a regulatory process for that. That's why I feel like that's kind of where we need to step in and educate there. Welcome guys, we're not too far in. Thank you for being here. The weather and traffic were pretty bad.
We weren't served fast enough.
That's okay, that's all right. We just started with a little supplementation chat. I'm going to hit on this question about MRI and abnormalities. The quick answer is no. MRIs don't always show every abnormality in the brain. So it's not an end-all be-all for diagnostic procedures. What I really love studying, I don't actually perform them, what I do love studying and have patients bring in is what's called a functional MRI. And that can give me a little bit more information, and what I equate it to is a swallow study. Right? So you can take an x-ray of your throat and see what it looks like, but when you do a swallow study, you see it in action. And a functional MRI is similar to that, in that you're actually watching an MRI as you have different thought patterns and you engage in different behaviors and emotions. So that helps recognize what parts of the brain might be lagging behind if there is some concern. Does that answer your question on that?
So is this an active MRI then? The brain is...
The fMRI, the functional MRI, yeah, it's more of an active picture. It's saying that as you emote or go through different situations that are provided to you, have different emotions, behaviors, then the MRI actually changes and fluctuates and can highlight which parts of the brain are active or which parts of the brain should be active and may not be lighting up per se as you would want them to.
So what does that look like? You go to the hospital and you're moving around and they take the MRI?
No, you lie still. It's just your thought, it's literally your thought pattern, your emotions, your cognition, so they can give you different situations or whatnot to try to get you to feel stressed or get you to feel joy or get you to feel anxious and whatnot, and then watching the different parts of your brain, you know, asking you to recall certain things and seeing if those parts of your brain, like the hippocampus, are lighting up to see if actively those neurons are firing. So, but MRIs are really important diagnostic tools when we are talking about any brain abnormality, brain health. So I definitely think that they're necessary and useful. I also think that they don't pick up every single thing that we have going on, especially when you're talking mild cognitive impairment and general changes to behavior and mood or memory that can't always pick up those early onset things. So in naturopathic medicine, we're really big on prevention and taking care of that whole person. So I think that's where hopefully we can come in a little bit earlier and start to reverse some of those changes. Overall, how are we doing? And we kind of started off just to catch you guys up in the back with general questions. This is open forum, so I want it to be super interactive. And so we just kind of start off with like a shotgun, like, hey, what questions do you guys have? What do you want to learn about today? So did you come in with anything? Do you have anything in particular that you want to talk about?
It's memory, probably.
Memory? Okay. Anything else back there?
I'm just polyvagal theory.
The polyvagal theory? Okay, great. Okay. So I kind of want to touch back on, so we already have one person, thanks for mentioning that you're kind of a caregiver, you have someone that you love with memory loss. Anybody else served as a caregiver for somebody with memory loss?
I took care of my mother for 6 years.
Right.
Wow.
Okay.
My mother had dementia.
What's that?
My mother had dementia.
Yep,
and had it,
absolutely.
and I didn't directly take care of her, but I was around her a lot.
Right. Anybody else around, anybody with a brain injury, brain tumor, seizure disorder, ADHD,
Autism.
autism, yeah. Any other brain, let's call it dysfunction, I would say puts you in the category of a caregiver. When we're talking about the organ of the body, which this is why I'm passionate about it, that truly tells everything else what to do, how to behave, how to emote, how to exist in the world, and that changes from the person that you got to know, that you fell in love with, that you were born to, that any of these relationships come into play. It's a huge challenge on the caregiver. It's a huge challenge on the other person. And I am so passionate about this because I am one for over 20 years for my father. And I do think the advocacy and the best person to care for these people and to understand the tools and what's happening with our loved one's brain is the caregiver. I mentioned at the beginning, and I'll repeat it again, is that patients sit in a doctor's office maybe less than 1% of their life, and they're with you or their loved ones for the majority of their life. So understanding what's happening, being able to advocate and say, no, I think you're overlooking this. My mother would have never said that. And while it may not seem abnormal to me, that is our role so often, is to sit down and tell somebody, no, she would have never said this. My dad would have never made that mistake. My brother would have never, divorced his wife or younger, whatever the case may be, whatever happens in our life, that advocacy and understanding that you truly are the best person to recognize brain dysfunction at the earliest onset for the hope of reversing it. So I do love to just chat about that and hopefully empower you to continue doing what you're doing if you are in that position, because it is challenging and it's heartbreaking and there's daily grief, but it's also so important to have a voice and be that voice for the people who don't necessarily have one. So the polyvagal theory, I am going to go into that right now because I do think it kind of spans into everything else we're going to talk about today. So the vagus nerve is our 10th cranial nerve. It goes from our medulla in the brain, and in Latin it translates to the wandering nerve. So it's a wanderer. It goes all the way through our heart, our lungs, and our digestive organs. And what the vagus nerve is most known for is it stimulates our parasympathetic nervous system. So has anybody heard parasympathetic nervous system versus sympathetic? And in layman's terms, the sympathetic nervous system is fight or flight. That's our caveman, we're getting ready, we're fighting or flighting, we're unsafe. Our parasympathetic nervous system is known as rest and digest. I love to add restore to that one, rest and digest and restore. And I love this conversation. I'm going to get pumped about it here with you guys because we only have the two. It's only one or the other. So while people want to think that there's all this gray area in life and there's all these different things that we can feel, your nervous system is only safe or it's not safe. That's it. So sitting with that for a moment and understanding in our autonomic nervous system, we are either fighting or flighting, or we are resting and digesting. There is truly no in between. And I say this to every person who walks into my door because your body's physiology changes with that autonomic nervous system, and we'll go into some of those changes that happen with it. But understanding that neuroplasticity happens when we're rested and we're safe, and it also happens when we're fighting or flighting. It doesn't just happen in this beautiful way. We talk about neuroplasticity where people learn how to smell through their tongue, or they learn how to do all these amazing things, right? Neuroplasticity, I learned how to walk again after my stroke. Neuroplasticity isn't always positive. Neuroplasticity also comes from, I'm fat, I'm useless, I'm worthless, I can't do this. Anything that we repeat to ourselves in a regular way, in a consistent way, creates the same kind of neuron growth as positive reinforcement. So we have so much power over how this neuroplasticity emerges in our body, and that truly is where I think so much of our nervous system health lies. In this, we're in our fight or flight, which is unsafe, or rest and digest. The polyvagal theory suggests that the vagus nerve, which comes from our brain all the way through our body, is the nerve that is stimulated every time we exhale. So with every passive breath that we take, when we inhale, we are stimulating our sympathetic nervous system. So we inhale, our heart rate increases, our bronchioles dilate, and we are surveying subconsciously our environment. Are we safe? Am I safe? And then you exhale, and it says, okay, now we can actually relax, and everything slows down. And with every passive breath we take, we go through this balance of sympathetic and parasympathetic. Now it happens when it's an abnormal tone, when we have prolonged stress, when we have childhood traumas, when we have current traumas, when we're driving in the rain through traffic from Blanchard down to Pilgrims, and we think the thing is going to start in 2 minutes. We stay in this sympathetic tone, and we have this imbalance. So what suffers from that, and this is the part that I think is so phenomenal, is that our body adjusts. So when we don't feel safe and we're in fight or flight mode, our blood vessels actually change. So we constrict our blood vessels in our viscera, in our digestive tract, and we dilate them in our muscles and in the back of our brain. We constrict them in the front of our brain, which is our prefrontal cortex, our executive decision maker, the one that lets you have rational thought. And I don't know how many of you, when you're really stressed out or anxious or upset or truly in fight or flight, have rational thought. But probably not many, because that happens in this executive decision making part. And it goes back to your amygdala. It's saying, okay, we are fighting or flighting. This is our carnal, innate, intrinsic ability to react to a stressful situation. And it goes to our muscles, it speeds up our heart rate, and it dilates our lung tree so we can run away or we can fight. When we are in an imbalanced autonomic nervous system, when we are sympathetic so often, which most of us live in, the things that suffer is this digestive tract. And we don't make the enzymes necessary to eat. We're eating on the run, so we don't smell our food first, which is really that cephalic phase of digestion. It happens in the brain. We start digesting our food before we even see it, before we smell it, before we even, any of it. Start cooking it, we actually can start digesting our food just by thinking of our food, by allowing ourselves to be in a space to eat that is safe and relaxed, and our nervous system is in a place where it can actually take in food. That's when we start digesting. And then we put the food in our mouth and our salivary enzymes start doing their thing, and it's like, oh, that starts working, so it triggers the stomach to make acid, which breaks down food, and then the rest of the process continues on. What I like to continue to say is, only when we're safe. And again, your nervous system only has 2 buttons. It either is or it isn't. So thinking of how many times you eat on the run, and then you have loose stools, or how many times you go visit Dr. Hunter or Coeur d'Alene Healing Arts because I can't get a hold of my stomach distress and I got poop problems, and oh, I also have brain fog and my skin is breaking out and I feel really stressed all the time. All of these come into play because of this polyvagal theory. This is to me, this is the puppet master. This is truly what's telling our body, we're in a safe place, go ahead and eat, nourish yourself, and we'll do the rest. We'll let that digestive process take place. The other part that I want to mention about that is the vascular system. Again, so I've already talked about, like, some of those vessels will open up, some of them will close down. If we want to truly nourish our brain and get the nutrients from our food, I mean, first we need to break them down, right? So we need to actually digest them. Then they need to be absorbed. So our intestinal biota needs to be balanced and our intestinal wall needs to be closed, right? Mouth to anus is a closed system. There isn't supposed to be any holes in there. It's 2 holes. So when we leak through anywhere else, those aren't being absorbed. That's not absorptive nutrients. So all of that needs to function properly. Then we get those nutrients into our bloodstream. Now that has to be able to deliver that, along with oxygen, to the places in our body that need it. And you want to talk about memory, and you want to talk about dementia, and being able to multitask, and ADHD, and what supplements do I take? I'm going to reverse back and say I'm not giving you any supplements if I don't think the end organ is going to receive them. And the end organ is not going to receive them if we're not digesting, metabolizing, looking at liver health, GI health, cardiovascular health, to deliver all those things to the brain, because it's a long way away to get it delivered there effectively. So in essence, that's the polyvagal theory in a nutshell. Any questions on that? Because I could just keep going on the biggest nerve.
So that's your leaky gut, your adrenal gland failure, all the above, right?
What is?
When you're not having a good, things going through well.
I would absolutely say it is a contributor to just about any disease in the body.
Yeah.
Because truly, again, I always go back to this: either you're safe or you're not. There is no in between when it comes to the autonomic nervous system. So if we're not able to absorb, digest, and this is nutrient supplementation, food, oxygen, think about getting oxygen to the end organs, then truly we can't restore health to any of them. And any therapeutics that you take, even pharmacologics, can't get to where they need to go and have the intended action. So I won't say it's the root cause of everything, and I won't say it's the cure for everything, because then I'd be a Nobel Peace Prize winner, or whoever came up with that would be. But I will say that it's implicated in anybody that walks through my door. I don't care what their chief complaint is. Before I prescribe or before I talk about diet and lifestyle, I want to know that whatever's going in the body is going to get to where it needs to go. And a really good example of this is any gut dysfunction, any gut dysbiosis that wants to work on anything or have health effects. So I do have a patient who has Parkinson's disease, who we just treated for SIBO after 6 weeks, and in that 6 weeks, after 15 years of being diagnosed with Parkinson's, she was able to cut her pharmacologic medications in half, because the ones that she was taking were actually being metabolized, absorbed, metabolized, and getting to where they needed to go. So that's just an example of how, just by making these slight adjustments and allowing food to be processed and absorbed and metabolized, can actually help your medication efficacy, your nutrient efficacy, and your overall nourishment.
Well, my question is, if you're in fight or flight constantly,
Mm-hmm.
I have a daughter who lives with me, and she was in a very bad accident with a very bad head injury, and my husband and I take care of her, and she's always in fight or flight, and it's just she's just being worn out with it.
Absolutely.
And with no answers, like, how do we help her? And I guess that would be my question.
Yeah, absolutely.
What can we do to help her?
Yeah, so there are syndromes where you are stuck in the sympathetic tone. There are instances in life where you need to be in sympathetic tone, you need to be reactive, and you need to be in fight or flight. If there aren't ways that we can get her into parasympathetic, which are, there are some nutrients, there are some supplements that can help calm that nervous system down. There are what I call interventional practices that can help introduce parasympathetic nervous system to the body: acupuncture, craniosacral therapy, biofeedback, and then also meditation is truly one of my go-to practices. And I always kind of joke with patients, I'm like, yeah, I'm the stereotypical, naturopath, I'm going to prescribe meditation for you. But when I go into the physiology of meditation and what we're actually introducing to the body and how that changes the physiology and everything else that we're doing, it tends to lead to a little bit better compliance. But with your daughter in that specific situation, I would recommend something interventional to say introduce the body to a restful state, like acupuncture or craniosacral therapy, to allow it to have some rest. Sleep is going to be a huge part of therapy for any brain health issue. So when we're asleep, we're in a deep sleep. We call that kind of flushing the brain. All of the toxins from our brain get flushed out through our own lymph system up there, through the cerebrospinal fluid and out. So without proper sleep, it's going to be very challenging to heal the brain. Anytime there is a traumatic brain injury, you were talking about lack of nutrients, lack of blood flow, and excitability of neurons. So those would be kind of the three tiers that I would work on specifically for your daughters. How do we lower those excitatory neurons? How do we increase blood flow to get the nutrients that are needed there? And also relieve some of the oxidative stress for her. But that's a really challenging situation and it takes a lot of time. But
It's been challenging a long time.
the earliest that there has been studies that the earlier you intervene in something like that, the better the outcomes can be. What's really challenging is that mild TBIs or mild concussions often get overlooked in conventional medicine. And while there are still symptoms or changes behaviorally, cognitively, things like that, there aren't a lot of therapeutics out there in the conventional sphere that can help recover. And that is where I feel like we have great therapeutics and support in that realm.
Well, she's gone with regular MDs don't even have it. They don't have a clue.
It's a challenge. I mean, we only know what we know.
Yeah.
But I do feel positive. There are a lot of nutrients that I have seen be very effective with TBIs and head trauma, CTE, things like that. So,
Can you use craniosacral to diagnose concussions?
not to diagnose, but we can use it to treat, to be a therapeutic in treating. So concussion is diagnosed. Concussions are tough because concussions mean there are no changes on CT. So concussion is you got knocked in the head, you didn't necessarily lose consciousness, and you have no changes on imaging. And it's a diagnosis of exclusion is kind of what we call it. So with that, it's really challenging sometimes to diagnose a concussion. So we have questionnaires that we can ask, we can have certain symptoms that we look for to say, yes, the probability that you have a concussion is high. But a concussion doesn't necessarily mean a brain bruise. There are a lot of falsities out there about what the definition of a concussion is. But how I always consider it is, again, kind of a diagnosis of exclusion. If it's not real bad and you're having some of these symptoms, then you probably have a concussion, and here's what can be helpful. Craniosacral therapy can be very effective for a concussion. Any other questions on the polyvagal theory or the autonomic nervous system? Anything to add, Dr. Hunter? Oh, thank you.
So now, how much does inflammation affect you as you get older? Because normally as you get older, your brain, loses a lot of its function and everything. But if you've had a lot of inflammation and had trouble with it, does it change, get worse? Because I've been quite effective in dealing with my adrenal gland failure, my inflammation and everything. But I am finding now that I'm older, I'm wondering if I need to totally re-gear the way I'm doing things, or...
Yeah, I mean, that's a really great question. So I don't know if anybody in the back in here is like, how does inflammation affect the aging brain? If I can kind of wrap it nicely in that.
Yeah.
And first of all, I say absolutely. So inflammation is going to have a huge effect on how we age and how all of our, multifaceted, all of our organs function as we age. The brain is especially susceptible to inflammation. We kind of call it immunosenescence, as we age, our immune system goes through changes. Our brain is also going through changes. We accumulate oxidative stress, and then inflammation puts a huge burden on our overall body. So I think if you're managing your inflammation, and a huge way to do that is by getting into that parasympathetic nervous system every day, then you can prevent some of that long-term damage to the brain. But there's more and more research coming out about the effects of inflammation, that our brain has its own, again, a lymphatic system, that it releases its own specific cytokines, which are inflammatory cells and messengers, due to stress and fear. And I'm going to come directly back to your question, but there's a really cool research paper out there that shows that people of lower socioeconomic status have higher amygdala activity, which is through functional MRI, and that amygdala is our fear center in our brain. And in that, they have a higher mortality and morbidity rate with heart disease. So all other factors remain the same. Age, sex, gender, all of the different things remaining the same. No other comorbidities like diabetes, heart disease. Then just this and alone, this higher amygdala activity, can directly contribute to cardiovascular health. And that is due to this whole new lymphatic system and immune system that they're seeing in the brain. So that kind of relates to what you're saying, but it just triggered me to say that.
It does.
So overall body inflammation, absolutely. Again, the brain is really susceptible to it. So lowering it's going to be effective. And I do think that if you're at a place where you're starting to see symptoms, or you're starting to experience brain fog or memory loss or Emotional lability is a huge one that people don't necessarily recognize, and that's not being able to manage or control our emotions so much. And typically that'll be like, oh, you must be having hormone imbalance, which also can be a thing. But that's really where we go with it first, and recognizing that, or being a caregiver, recognizing, hey, this just feels off. I don't think that my mother, my father, my sister, my brother would have necessarily reacted that way, is a huge key or cue to say, hey, something might be off regulatory-wise in the brain. So I guess I'm just agreeing with you that modulating your inflammation is going to be very important for your overall brain health as you age. And there are supplements that can help do that, is kind of where I was ending with that can help lower that inflammatory load, that have an affinity for the brain, and that's where I would go to boswellia and curcumin or turmeric.
So those are the supplements that you mentioned earlier, like boswellia, turmeric, ginkgo, bicopa, all those?
Yep, so boswellia and turmeric are pretty much my go-tos for lowering inflammation that have an affinity for the brain. The bacopa and rosemary and ginkgo are more to kind of cue that memory, to get it stimulated, to fire the brain up, I say. So if you have rosemary and bacopa when you're studying for a test, or if you had it before coming in here today, you might be able to retain those memories a little bit longer. And then fish oil, the choline that you mentioned, other structural support.
How much fish oil is good? I mean, okay, I'm 73 years old, and
Okay.
I'm dealing with that. Some brain fog, you know. And so I started taking pretty high turmeric. I get it over at Costco, and I think it's helping me some, but I still have it in my hands, and I feel like I need to get more, take more things.
Get more things. So fish oil, it all depends on kind of what your state is, if you have diagnoses or if you're looking to just support your health, but I wouldn't go any lower than 2 grams a day.
Oh, 2 grams, yeah, I take like 1 gram now, maybe up it a little bit here. Yeah, okay, good.
I hesitate giving health advice at these specific. I would need to know a little bit
What
more.
about cod liver oil? I mean, quality cod liver oil.
Yeah, so what you're looking for in your fish oil is the EPA and DHA. So whatever it says on the front, I can almost say just ignore it, flip that bottle around, and look at your total EPA and DHA. Those are the omega-3s that we're looking for in your fish oil supplement. Fish oil is a really, really tough one that I can't say enough to find some quality checked fish oil, because fish already is so tainted and destroyed and not sustainable, and I really want to protect the environment and earth as much as I can in this as well, but also recognizing that there's a lot of fillers, and there's a lot of bottles that say, 2 grams in 1 cap, or blah, 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 and they'll have all this in the front.
That you prefer people to take, or you prefer for people at high quality?
Yep, I like the Pharmax brand quite a bit, and I like a liquid fish oil. I think it's a little bit more bioavailable, it's easier to absorb. Doesn't always taste as great, but actually I hear less fish burps with the liquid. And you can take fish oil with food. It eliminates a little bit of the bad taste and can lower your burping sensation. And then another great brand is Nordic Naturals. Nordic Naturals, and they have a good quality brand as well. And again, those aren't the only 2 out there. Those are just 2 that I'm familiar with, and I have no conflicts of interest, I'll say that, and I'm not being sponsored by any pharmaceutical or supplement brand. But again, the biggest thing is just flipping that bottle around and seeing what the EPA, DHA concentration is in there, because they could add a lot of other good things in there. Anything to add on that, Dr. Hunter, as far as? Okay. And then vegans, if there are any vegans in the room, then you have a little bit more work to do to get the precursors to those omega-3s. And that
That was my other question, diet changes, I mean, to reduce any symptoms of brain fog or whatever.
Yep, so there's a diet out there called the Mind Diet.
Right?
The Mind Diet. And I laugh because they basically took the Mediterranean diet and put a new name in front of it. That says anything that's really good for your health is good for your brain. Yep, so the Mediterranean diet is really where I would go to for dietary advice there. And then obviously following any specific health conditions for what you need.
About infrared saunas.
What about them?
Well, I have one,
Okay.
and I rely on it a lot. I get it a lot more than I used to.
Okay, and what are you going in it for?
detoxing my body.
Mhm.
And,
So what did you call that?
infrared sauna.
Oh,
An infrared sauna.
Okay, I missed the sauna part, so I was like wondering
It's
what you were
detoxing,
infrared.
yeah.
So I'm really glad that you brought up detox. I think that's really effective. I do love an infrared sauna, but you are going to be hard pressed to find me recommend anything other than good old fashioned intentional movement for brain health. Of all the things, of all the papers I've read, all of the research that's out there, I can say this with confidence, the only therapeutic that has been proven to reverse the progression of cognitive decline, Parkinson's disease, Alzheimer's disease, all of these different brain health things is intentional movement and exercise. There's other nutrients that help, there's pharmacologics that help, diet, lifestyle, all these things assist, but truly dose-dependent exercise is one of the most proven effective therapies for brain health. So I cannot.
It's a little hard to go with COVID, being I was a part of the gym up at Newport, and they closed the gym down.
Can you do this?
Of course.
Can you?
Yeah.
This is one of the best exercises for brain health. Left to right.
Is it?
Left. Oh yeah, you're moving all the things. You're going left to right. Do you like to dance?
I was in dance for years.
They're dancing,
When I was in
Zumba,
the city.
planking. Just a straight plank is actually a phenomenal exercise for your cerebellar health. Balance, coordination, mental concentration. Not to mention a great core workout for any of these ladies who pee a little bit when we sneeze. Do some planks. So,
About elliptical.
great.
I got elliptical.
You say it, I'm going to say great. You say any intentional movement or exercise, I'm going to be like, I'm in it. Sit and be fit. So rarely does anybody get an excuse written or an exemption written from me for exercise, or it's a great sit and be fit protocol that protect your knees. You can get online and they will make you sweat. I don't care how good a shape you're in, you go do that, you're gonna get a good workout. So, and the thing about exercise that it is dose dependent. And I can say this for Parkinson's disease, I haven't studied it with all of them, but for Parkinson's disease specifically, 4 days or more of exercise helps slow the progression of disease. All other factors equal. Anything less than 4 days has no effect on the progression of the disease. So it does matter. Again, just like supplementation,
So 4
just
days
like
of what? Half an hour of exercise or an hour? I mean,
4 days of intentional exercise.
where you
and
get your
movement.
heart rate up.
Yep.
Yeah.
So you can't say the Pledge of Allegiance without breathing hard. Let's go there. But I would say, at least 30 minutes would constitute a good exercise.
Can I share something on that subject?
Absolutely.
Okay, I was diagnosed possibly with Parkinson's about 3 years ago.
Okay.
And so I started doing things like riding a stationary bike and reading a book upside down. Anything that's issued a new challenge to my brain. I took improv comedy class.
Ooh.
Think quicker, Tai Chi, learned foreign language. And I took a neuropsych test 5 years ago.
Okay.
And after about 3 years of all this activity, the score improved with what you're saying with all the activity is critical.
Yeah.
And new research that I've found says that ballistic training, like high-speed cycling at maybe 90 RPMs, is more effective than, say, walking, but higher ballistic training is effective.
Yes. I would agree with that. So biking has been proven to be one of the best exercises for people with Parkinson's. Again, a lot of my research citing is with Parkinson's disease specifically. So that's my focus. But yeah, biking is one of the best
for
ones.
dementia too, wouldn't you think?
I would think so. Yeah, absolutely.
It's gotta really get your heart rate up and get everything moving.
Yeah, 100%. And Bredesen published a great paper and wrote a wonderful book, and he got a lot of kickback from the conventional world because basically he called it a cure for Alzheimer's, or the end of Alzheimer's, I believe. And unfortunately, the title was chosen poorly, I think. I think the content is phenomenal if you have a chance to read it. There's also one, The End of Parkinson's, and they're super similar. And the content in it is to say that this is what you can do to care for your brain and your body and slow the progression. I think the hard part is he got shunned from the conventional community because he basically claimed to have a cure, and that didn't go over well. But everything that you're doing, I applaud you in that, because if I could get half my patients to do half of what you just said, the results would be phenomenal. So I think continuing on what you're doing and you're living proof that it works and you're living well. And again, we have my mentor, Lori Mishley, is world renowned. Actually, she's sponsored by the Michael J. Fox Foundation. She studied for the NIH and the WHO, and she goes to the World Parkinson's Congress every year. And she focuses, again, just on Parkinson's, so that's my focus as well. But the end of that to say is she's really shifting the paradigm of research as well. And I'm going to dive into that a little bit with you because as far as the brain goes, it is uncharted territory. We just still don't know what we don't know, and that's why we're always coming up with these new pharmacologics and imaging and different things that we can do to try to diagnose earlier. And really what Lori says that I love the most and I've adopted is that we were treating scurvy for 300 years with limes before we knew it was the vitamin C.
Oh, wow.
So before we knew there was a deficiency of vitamin C, we were treating this disease with limes, seeing that it worked, and we were like, boom, let's keep doing it. We're not causing any harm and we're helping. The current research paradigm is now such that you can't use those limes and you can tell me what exactly is in it that's helping this disease. And we don't know what's causing the disease and we don't know what's in the therapeutic, it doesn't get approved for treatment. So what she's doing is saying she has this giant survey out of over 5,000 people with Parkinson's who have said, here's what I'm doing, here's what's working. Then there's some computer algorithm thing that equalizes all of their factors but one over and over and over again to say, yes, eating organic helps. Yes, dose-dependent exercise is helpful. Yes, the Mediterranean diet. Yes, this. And then here's all the bad. Dairy, terrible for people with Parkinson's. So, inflammatory foods are going to contribute to all of these diseases. But I just wanted to share that. And again, it's specific to Parkinson's. And I also feel very confident that there's research out there for other neurodegenerative diseases that parallel it. And Dale Bredesen showed that. And his protocol isn't easy. Somebody would have to commit their entire lifestyle shift to get the results that he is claiming to have. And also, if you have a loved one or you suffer from memory loss, then I think that would be a motivating factor.
So is dairy good to get off of if you're trying to lower your inflammation?
Yeah. It depends on how you respond to dairy.
Okay.
I'm one of the very few people I think who's going to be like, this is the hard and fast rule, other than, if you ask me about heroin or cocaine, I'd be like, probably best that we move away from that. But it depends on how your body reacts to it. If you can digest and absorb dairy and you don't have anything going on and your inflammatory markers look fine, then I'm not in any position to say you can't do this. What I can say is the research shows.
I know when I start taking more dairy, I have more inflammation.
You're a phenomenal doctor then. Everybody is the best doctor of their own body, and it's really important for. I don't like to answer those questions because typically when I pose it that way, everybody's like, oh yeah, I feel like crap when I eat that. I'm like, okay. So that's truly it, and we can do the labs to prove it, or you can say I just don't feel well when I eat that.
Are there any indicators to show that your diet or your health style maybe could have contributed to the onset of those diseases?
Absolutely.
I mean heart disease, things like that
Yeah, neurological disease. So environmental toxins is a really big one. We tend to do an environmental screen with most people who come in with neurological disease because they are so destructive to our neuron system, to the structure and integrity of the nervous system, and then also just to the overall inflammatory response of the body. And the difficult part with environmental toxins is they get stored. They get stored in our fat cells, they get stored in different body compartments, sometimes our bones, and then they can affect you for life. So that would be one thing that I would look at. I do think genetics plays a huge part into neurological conditions. And while I think it can flux, I don't think it's written in stone that this is what your genes say, so this is what it has to be, but they definitely have some hints and cues to why that it could have been an onset. And then elevated blood sugar has been shown again and again and again to be a lifestyle contributing factor to different neurological conditions. And a lot of people lovingly will call Parkinson's disease type 3 diabetes. Is because so many of the people with Parkinson's will have elevated blood sugar. And while on the topic of elevated blood sugar, I also think it's important to note that while high blood sugar is detrimental to the body and low blood sugar is detrimental to the body, the waxing and waning between high and low is actually the most detrimental to the body. So even if you have high blood sugar that's unmanaged, so you'd have these sharp drops and then it comes back up. That's actually worse than if it was just steadily high. So it is something that you would want to get looked at, is managing that blood sugar so it is at a steady level. So I always found that to be very interesting, that the body having to compensate for those fluctuations is actually worse off than staying high.
Talking about diet and that, the worst and the best thing I ever did was the elimination diet. Because I feel so much better knowing, but oh, it was so painful. Because I was old school, been trained to be an old school dietitian.
Okay.
Everything that I was told that was so good for me was not.
Right.
Was killing me.
Yeah. I think anybody over 50 has gone through like eggs being good and bad at least like 10 times, right? Like they're great, they're terrible, they're great,
Fat.
they're terrible. Yeah. So
Wheat, the whole gauntlet.
right.
That's awful.
Yep, so and I struggle. I mean, we take all the nutrition training, and when it comes to restricting nutrition or getting into the weeds of the biochemistry of nutrition, I come a lot to here. I'm going to educate you on what food does in your body, and I think when people understand that aspect of it, they tend to make better food choices. And acknowledging, I mean, that little back and forth that we just had is one of my favorite things to do. Is, hey, should I eliminate this? I'm like, I don't know. How do you feel to eat it? Terrible. Cool. Let's eliminate it if you want. If you don't, then let's find other things that support your body in taking it and digesting it. The one thing I want to add about the elimination diet is it's only half of the diet. It's the elimination re-challenge diet, right? Did you do the re-challenge part?
Okay, explain. It's been a few years since I've
Yeah.
done the actual elimination to find precursors. I also had a big gauntlet of allergy tests,
Right.
and didn't find out anything interesting, but then after eliminating all of them for the 21 days, that's the one I did,
Okay.
and then slowly introducing them, I found out. So I'm not sure which one.
So that's the re-challenge part, is the reintroduction part that
Yeah.
you're saying.
Yeah,
And
that was the painful, ugly part.
it can be. What I think is always missing in the fear part of the elimination diet, and Dr. Hunter, you can definitely jump in here, but what I see is that I have to eliminate what, and then if it comes back positive and I don't like it, then it's gone forever and I can't ever have it.
True.
And I don't necessarily think that has to be the case. Like I said, the tube from your mouth to the other end is one closed system. And if there are no food allergies, so we're talking IgE, immediate food allergies like celiac disease, or where your body actually cannot take that food and has an immediate response to it, but an IgG, an immunoglobulin, showing a food sensitivity, then we like to go and say there may be some leaks in the gut where these food particles are coming out and you're creating this immune reaction to it, and you're sensitive. So you're having diarrhea, constipation,
Or
other
all of the above.
hives, brain fog, lethargy, all these different symptoms that can come from having these food sensitivities, because it should not be leaking out of our intestines, right? It's one closed tube. So when we eliminate all the food and we do some gut healing work at the same time, then the hope is that when we reintroduce food, especially food that's not harmful to our body, that we'd be able to then take it and absorb it and eat it again and reintroduce it into our diet. So I think from where I sit, the elimination diet is so scary and creates so much fear with people that I like to say it doesn't have to be forever. If you're having these sensitivities to food, let's give your gut a time to rest and restore and eliminate it and do some gut healing work and tighten those junctions in our intestinal cells. And then when we reintroduce the food, you may have no reaction at all, and then great. Eat it in moderation, eat it healthily, whatever the case may be there, but it doesn't have to be a forever thing. Now I will say Dr. Hunter is much more experienced at those kind of therapies, so if you have anything to add there, I would love that.
Yeah, I mean, I think you said it well, and it's just, appreciating so many more diverse sets of forces that influence how our guts get disrupted, and not just food. I mean, how stressed we are, the whole polyvagal theory is pretty important in that.
Right.
And you're not mentioning you're mentioning the absorption, but the digestion of food is just so critical.
Right.
How well we chew our food, how relaxed we are when we eat our food, whether or not we overeat. These are very fundamental. And if we get caught up in the foods too much, we can miss these
Thank you, yeah, it's a great point, is bringing it right back to, you know, how we are existing with food and how we're nourishing our bodies in all of the ways, not just the food that we put in. So I think that, thank you for reminding me of that.
I'd like to get back to blood flow,
Mhm.
the buildup of cholesterol
Okay.
in this back of your head,
Mm-hmm.
you know, and it's just not anything that's reversible and can be surgically fixed, so we need help regarding that
Okay,
memory and.
so you're having some atherosclerosis in the back, some cholesterol
80%
buildup.
one side and 40 the other.
Yeah, so I will say the very first and foremost thing is whoever you believe engineered our body did a really wonderful job with compensatory mechanisms. So one thing gets blocked, another thing usually can pick up the load if we maintain health and maintain our nutrient level and decrease our cholesterol intake and take appropriate interventions if needed for those issues, for those individual issues. But as far as the vascular system to the brain goes, it is so redundant. It is actually a beautiful thing. If you ever just YouTube, you know, or go online, if you really want to geek out and see the coolest videos ever, it's the vascular system of the brain and neuron synapses. They actually can now zoom in close enough to see little neurons like do this to each other. And then they keep going and they meet, and then they touch. And then it's like a whole new synapse, a whole new learning just happened there. So those are just really cool videos if you ever want to nerd out on the brain. But the vascular system has been shown time and time again with transient ischemic strokes, with actual regular strokes, with TBIs, any brain injury, to be extremely redundant. So when there is blockage in one artery, hopefully other ones can, you know, pick up the slack. The problem with if there is atherosclerosis in the entire body, then a lot of the vasculature is affected. So lowering that cholesterol level is going to be number one, right? Take away the offender. Lowering oxidative stress, getting on therapeutics that help blood flow to be more effective. Dilating those blood vessels. Practicing parasympathetic activities that we are known to dilate those blood vessels even more in those small capillary beds to help the efficacy of blood flow, getting the nutrients into the blood that we need. So if we have a smaller hose, we want to jam pack that hose full of the nutrients that it needs if we don't have one that's normally as large as can be expected. So there's a lot that can be done in that instance, but I would say the number one thing is, you know, remove the offender.
And that's caused from high cholesterol for too long or something?
It depends. Everybody,
okay.
I mean, it could, in that particular case, I'm not sure why there's excess cholesterol that she was mentioning, but it can be from excess intake, it could be from the body's inability to metabolize it.
And would that's
Low-
called what? Vascular?
Atherosclerosis.
For some reason, that's not tripping a memory.
Oh, that's okay. It's hardening of the blood vessels.
Oh,
How about that?
well, I probably have heard it
Yep,
that way.
There you go. Does that answer your question, Em?
Thank you.
Okay, of course.
Does it hinder digestion to eat standing up?
That's a good question.
What was it?
Does it hinder digestion to eat standing up? I wouldn't think so, as long as all of the wickets of digestion are met. And, you know, I would think gravity would actually play a cool part in that. You know, I often prescribe like steel drops for somebody with reflux to push everything down. But I think as long as you're meeting that cephalic phase of digestion and you're being mindful and you're chewing your food and everything else is functioning, then I would guess no, but I'm open to anybody proving me wrong on that one. But I don't know. I've never seen any research on that. Do you eat standing up?
Yeah.
If you're standing, you're probably hurrying too fast.
It could be if you're standing and relaxed. That's what I'm saying. If all the other things are met, then I don't see any physiologic or structural reason that it could hinder it.
Like you said earlier, everything works better with movement. So I walk around the kitchen, but still honor the thing Dr. Hunter said about putting your fork down and eating slowly. Seems like gravity would be in your favor if you eat standing up.
I think if it works for you and your bowels are good, then I'm in no place to say one way or the other. And if your individual physiology likes to eat standing up and you're doing it well, I'm all about it. I think it's interesting. Do you feel relaxed?
Mhm.
Okay. Anything to add on that, Dr. Hunter? I've never had that question before, so.
That's how they, in the military, a lot of, through basic, that's how they have to eat going down the line.
Yes.
Because I've known a couple of military people who, that's how their preferred way of eating, and they make it work for them.
They also give us shovels. Just eat as fast as you can.
Yeah, well, in those cases, not so much, but.
Right. Yep, so, no, we don't want to do it that way. Military training is not good for your nervous system. I can say that from experience.
I bet you can.
What else? What other questions do we have? Anything is up for grabs.
Intermittent fasting, are you for that?
Am I for that?
Yeah.
So it's individual, and I know that whoever's watching this, and a lot of you guys are gonna be like, oh my God, you say it depends one more time. But truly, I don't recommend it for everybody. If you have a blood glucose dysregulation, if you have a metabolic disorder, if you're having some brain dysfunction or abnormalities, sometimes it can actually not be helpful. So our brain is only 2% of our body weight, but it takes 20% of our glucose, of our energy requirement. So our brain is an energy suck, literally. And the main fuel for that is glucose. And so if we are doing intermittent fasting and we already have either low blood glucose or we have a glucose regulatory system malfunction, or our brain is in high demand and it's not functioning properly, then it would depend on the person to say whether I think that's actually helpful or not.
I felt wonderful with it.
Yeah, I think it can be really helpful as
I'm
well.
not doing it now, but I did for a period of about 6 months. I got 30 pounds and felt wonderful.
Yeah.
So I'm thinking about going back into it.
Yeah, it's an excellent therapy, and I do use it a lot, but again, it's on an individual basis, and obviously making sure that your body can maintain its proper function, especially when the brain needs and requires that much fuel and energy.
Hypoglycemic people should not fast.
Most likely. Unless we can regulate the blood sugar,
See,
get to that point.
That was trying to fast,
Mm,
tripped that memory.
yeah, absolutely. Yes, sir.
This Prevagen they advertise on TV, does that help your memory?
Prevagen, so what I can say about helping your memory is nobody knows what helps your memory, but what Prevagen does is provides the nutrients and the cofactors that we kind of talked about earlier for structural support and the nutrients that we need to have proper brain function, which then enhances its functionality, which is memory and cognition. So I would say that I think Prevagen is a really great supplement. I don't know the exact, everything that's on the label. So that is where I would be like, I don't know what the therapeutic dosing, if they're meeting that for what we know the actual ingredients to be useful. But I think what it does is it meets a lot of the wickets that we're talking, lowering inflammation and providing some of the structural nutrients that are required for proper neuron health. But memory, exercise, as I said, teaching yourself a new language, doing an activity. One of my goals in life and something that I did when we were over in Seattle was offer fly fishing classes for people with Parkinson's. Anything that uses both sides of your body that entails you to be mindful. If you take a dancing class and you don't like to dance and you're more worried about tripping and looking like an idiot, then you're not worried so much on your tremor or your condition, and you're teaching that brain something new. So I would say full immersion activities are always going to be more effective than a supplement or something that you can take, because you're using those neurons, you're creating that neuroplasticity, and keeping in mind, I wasn't sure if you guys were here at the very beginning, but neuroplasticity is not always a good thing, right? We teach our brain good habits, and that creates neuroplasticity. We also teach our brain bad habits, and that creates the same neural patterns. And when we create a neural pattern, the first time, it's like walking through a jungle. It's going to take time, and it's hard, and it's tedious, and you're pulling these giant branches, and you're getting bit by flies, and there's weird noises, and you're going really slow through the jungle. And the next time you go down that path, you've already moved like the big giant branches, and now you just, kind of go through and move some of the small ones. And the next time through, now you're padded down a little bit, so you can go a little quicker, just little grass. So neural pathways take time, and they take repetition. The part that's, again, so empowering and so important to know is that when we talk about polyvagal theory, when we talk about mindful eating habits, when we talk about meditation, any of these practices we teach our brain to do that enhance our health and our physiology, when we leave this room and you feel really pumped to go do it, and then you get in traffic and your blood pressure shoots up and you don't engage your breathing exercises and you go in sympathetic tone, you're teaching your body to do the opposite. So it does take this commitment to say and recognize and having that awareness to how we're responding and reacting to teach those neuronal pathways to exist. And while it's hard at the beginning, it gets easier and it can actually change the whole structure and function of your brain. So. What else?
You're familiar with the term bradykinesia?
Yes.
Is there a way you can mentally intervene before that sets in?
So bradykinesia is, by definition, moving slow.
Right.
It's one of the top 4 diagnostic features that is used to diagnose Parkinson's, so I just want to give some context for it for the audience. As far as bradykinesia goes, in a biochemical sense, it is due to a deficiency of levodopa, of dopamine, from the brain, which is in the motor cortex, the substantia nigra of the brain, which is responsible for initiating movement. So when we have a decreased amount of dopamine, we can't initiate movement or we can't do these motor functions as quickly as we normally would. This comes on in Parkinson's disease, sometimes rapidly, sometimes slowly. Now, if you can recognize these things, there has been a lot of research shown to enhance the dopamine use in your brain and the efficacy, and meditation and mindfulness are 2 of them. So being aware of that it exists and being able to focus on where you're going and how you're doing, mapping it out, being familiar with places, avoiding stressful situations can all combat bradykinesia. Now, if you're to the point of diagnosis, especially with Parkinson's disease, by the time there is a diagnosis, typically we've lost 80% of our dopaminergic neurons. So there is a physiologic sense in that specific disease that says we're starting off behind. We've already lost the neurons, so what we do have, we want to enhance their efficacy, and then also supplementing with levodopa can help those, what we call those motor symptoms, or how we're showing it on the outside of Parkinson's. But there is a lot of evidence to show that mindfulness and attention can help with motor symptoms as well.
In the moment.
In the moment, absolutely. And lowering stress is one of the biggest ones. So freezing gait is another motor symptom of Parkinson's that sometimes will go along with bradykinesia. And where we see it the worst is when somebody's in a new environment, in a stressful environment, around the holidays, they went shopping, somebody cut them off. Anything like this will cause this freezing of gait. And Deepak Chopra actually had a really amazing exercise with somebody who had frozen gait, and they were being asked in physical therapy, I just need you to walk across the room, just walk across the room, just walk across the room. And this person could not initiate movement to walk across the room, and they were frozen. And they came in, Deepak did, and drew a line, a chalk line on the floor. He was, you just walk across the room, just step across this line. And then boom, they were off. So there is a mind over matter aspect to it, while also recognizing in that specific disease sphere, there is a loss of some of the neurotransmitter that's responsible for that movement. So it would just depend on the context of the bradykinesia, I guess. Does that answer your question?
Well, I read where we use just a small percentage of our brain potential.
Mm-hmm.
So I'm trying to find a way to tap into the rest of it to override the bradykinesia.
Yeah, I mean, that's neuroplasticity at its finest, is training the brain and being open to doing those things. And also understanding, I will put another plug in for gut health, our neurotransmitters that we give our brain all the credit for making, serotonin, melatonin, a lot of those neurotransmitters are actually produced in the gut at a much higher amount than we make in the brain, and we give the brain all the credit for those. So,
Can you measure dopamine level in the brain?
you can measure the metabolites of neurotransmitters, but we haven't been able to measure exact dopamine in the brain. How we know that statistic about dopaminergic neurons is from autopsies of people with Parkinson's. Yeah. I know. But a functional MRI would be really interesting to see if we could see that substantia nigra, that part of the brain where our dopaminergic neurons are the most concentrated, to see if that shifts in its activity level. So I can do some more research on that. I think that'd be really fascinating. Yes?
5-HTP,
Mm-hmm.
makes you feel better. I take-
PSA by the lady in the front.
Up to serotonin level.
Yeah, so 5-HTP is a precursor to serotonin, so it can help some people very much. It doesn't help everybody, and also understanding biochemistry is just like cooking,
Already
right? You can throw all the ingredients in a pot, but if you don't ever cook it, it's not gonna make what you're looking for. So biochemistry is a similar way. You can put all the 5-HTP in somebody that you want, but if they don't have the cofactors or the things necessary for a
That would
biochemical
make
process.
sense, because I take it and I just feel better with it.
Great.
My son, he started taking it because he was on, tranquilizer. Or depression medication. Talking maybe getting off 5-HTP. But he said it didn't really help him.
And again, I mean, I just feel like a broken record, but gut health too,
Yeah.
right? Like anything we're putting in our body, we have to be able to use it. So, and to know that that's the root cause. So that's another question I posed. Do you think you feel sad because you have a deficiency of 5-HTP? Or do you have previous life traumas? Have you had a concussion? Do you have another imbalance? Are you eating foods that aggravate your mood? There's a whole plethora of questions that, I feel should be investigated when we go into supplementation, because so rarely are the symptoms we manifest a result of a deficiency of turmeric or 5-HTP or whatnot. So they can be helpful in our body's ability to maintain a healthy balance, and also, is that the root cause of why we are where we're at in our health? So, always necessary, in my mind, to come back to those important questions. Yes, sir.
I eat really healthy during the day.
Mm-hmm.
Then at night, about midnight or 1 o'clock, I just crave a carb or a sugar.
Okay.
Is my lack of discipline, or is there some reason? Can you give me an excuse for doing that?
I would think, my gut reaction is to think that there might be a blood sugar imbalance there. Typically when we have those really strong surges of cravings, then our body is saying, oh my gosh, we need glucose, we need energy, we need fuel. So that would be my first suspicion, is how is your body utilizing fuel? Is it getting enough during the day? And when we eat really healthy, sometimes we eliminate a lot of fuel for our body. So that would kind of be where I would start with saying, why are we having those cravings? What else is happening? What else are you eating throughout the day? And making sure that, again, we keep the glucose level throughout the day, rather than these sharp drops that cause us to have those cravings or other symptoms of hypoglycemia or low blood sugar. So I think if you're eating well all day during the day, I'm going to say kudos to your discipline. That's a lot better than 99% of people can do. And if it's something that your body is feeling and it's not a disciplinary thing or a habit, then I would think it'd be more of a physiologic craving that your body's actually signaling to you.
How do you stop it?
How do you stop it? It would be a pretty thorough, dietary evaluation. What are you taking in? And then checking your blood glucose levels. So seeing if those are fluctuating throughout the day, getting a good reading on you. Investigation into how your body's metabolizing everything. Dr. Hunter, do you have anything to add on that?
Yeah, I think that you shared that with me before, Randall. Yeah, I think it's a good area to explore, and I think it's also a really patterned condition that you've been doing for a long time. Makes it more challenging to make new pathways.
I used to drive to McDonald's at 2 o'clock in the morning. Now I eat something, but for Dr. Hunter's advice, I just eat something healthy.
Well, I really like that advice, and I wouldn't want to be on the road with you at 2 in the morning if you have a craving for McDonald's. That's a pretty strong craving. No, in all seriousness, there's definitely habit patterns that have been built, those neuronal pathways and cravings, and comfort food is a big thing, and Also, there are physiologic responses that your body is telling you with cravings, and that I think we need to investigate. And then with just a little that you've shared of a possible diagnosis of Parkinson's, in with that, with any neuronal condition, any neurodegenerative, any brain condition, nervous system condition, the nerves, I mean, the nerves are the bosses, they're the puppet masters. I love the nerves, but blood sugar dysregulation comes as a result of that a lot of the time, so they go hand in hand. So, you know, everybody thinks of type 2 diabetes as this lifestyle disease that only obese people get, or people who just eat terrible food, and it's not necessarily true. We can have metabolic disorder in a seemingly perfect or physical healthy person, and it's dependent on a lot of other factors, so.
Your thoughts on really good quality grass-fed whey protein powder as a supplementation?
It would depend on if you're meeting your protein goals, and if that's a protein that goes well with your body, and why you'd be taking it. So again, it depends.
Yeah. How would you know that you need to take it if you're tired in the afternoon or want to get hot sugar?
There's specific protein
Carbs.
goals that honestly the RDA has put out that I follow. So as far as that, I look again at a dietary evaluation of what you're putting in your body and ensuring that you meet protein goals, and then it also is based on your output, right? So protein is the building blocks for things. So if you're an extreme athlete or
I
you're
don't really know how
in
much protein to take in. I mean, where do you find that?
Google.
There's a formula. There's
Oh, no,
actually
you
a formula.
Yeah, the RDA recommends a certain amount of protein for
Okay.
males and females, daily allowance of what's recommended. And then again, you take that with a grain of salt. So, these elite athletes who are breaking down muscles and working really hard, or people who fast, or people who can't take in certain amount of things are going to have adjustments to that, but they have a generalized recommendation for how much protein. Or what percentage of your macronutrients should be protein. So people much smarter than I have come up with those formulas.
Yeah, it's interesting.
So I don't even remember what the title of my talk was. Integrative neurology. There was a lot of we talked about diet, we talked about some lifestyle, we talked about poop, talked about the polyvagal theory. We talked a little bit about caregiving. I know that was in my title. Does anybody have any other questions on that topic? So the one resource that I do want to put out unsolicited is the 911 for anybody who is a caregiver of any sort, and it's 211 from any landline. More often than not, people get put into a situation that might be out of realistic expectations to control. And 211 is a central hub for all things respite care, resources, financial planning, anything that you could possibly think of. It's a central network in your county that can direct you to what's needed for the person that you're caring for. So one of my absolute all-time favorite resources to use and call. I've spent many hours on the phone with 211, and also to suggest to patients, because everybody has individual needs and there's different resources, and it gets very overwhelming. And if you've ever been a caregiver, you have very limited time to put in energy to do that kind of research, so you end up taking on all of it. In addition to that plug for 211, I do want to share a fact that to me was extremely sobering and keeps me very focused and passionate with serving caregivers, is that 40% of those who care for their spouses with Alzheimer's disease, so it is limited to spouses, but it's still interesting. So again, 40% of those who care for their spouses with Alzheimer's disease actually pass away before the affected spouse. So the toll that it takes to be a caregiver when you're talking preventive health is immense. So finding help, finding respite care, knowing where to go to seek it is extremely important to me as a provider and as a human. So that is one thing that I definitely didn't want to leave out today, because I knew it was in the title. So I'm really excited you guys all showed up today. It was my first open forum, and I'm happy to stay after and talk to you guys one-on-one. I do have a mask, so I will don it for any individual conversations. And hopefully you took something out of it. And I'm pretty accessible. I have a flexible schedule. I work Monday, Wednesday, Friday at Coeur d'Alene Healing Arts. So,
Coeur d'Alene Healing.
yeah, and again, I mean, even if you have an email or a question from today or a clarification, I'm happy to respond or do more research and investigate further, because I love to do that, so.
That was very good.
So thank you.
Thank you.
Yeah, thank
Travel
you.
safe tonight, everybody. It's dark and rainy and.
You've helped me form a bunch of questions to ask my naturopath when I go.
Oh, great.
I'm way past due.